And then I will turn over to Supervisor Van Cree for her to open hers.
And honoring is on. Would you be able to send a link to Allison Leahy? Supervisor Leahy? Oh, she is? Okay, perfect. Okay, great. So seeing there's a quorum of the Health and Human Services Committee, I will call the meeting to order.
Assume we have no public comment. Did anybody from Health and Human Services? Michelle, did you have anybody?
Nope, doesn't look like it.
Okay. And then I guess we'll get right into 3. Policy issue discussion, potential committee determination. Consideration of the opioid settlement fund deployment recommendations from Criminal Justice Coordinating Council. So at this point, go ahead, Michelle. I know you wanted to have a joint meeting, so I thought it was a good idea also. So here we are. Did anyone have any questions? I guess we could just open it up that way.
Yeah, have you guys did you get the presentation about what happened? Oh, the same thing. Okay. Yeah, so at our last Health and Human Services Committee meeting, the committee asked if we could have a joint meeting so both committees could talk about how to move forward and what to bring to the county board. So that's why we're here today. I guess if we want to open it up for discussion or if you had anything you wanted to add.
No, I'm just opening up for discussion. I want to hear, we've had some time to digest it now, so I guess just open it up to the floor.
Okay, Supervisor Krause.
Thank you. I have lots of questions, and I sort of wish that the previous people who left would have stayed to answer some of the questions. But I was wondering, it says that it would help with sobriety, and I'm thinking that's just not people who are alcoholics, but they also have an opioid addiction. Is that correct?
That's what the settlement actually is for opioid.
But it says in the information about sober housing and counseling, sobriety counseling.
Well, sobriety can be whether it's drug or alcohol. So it covers both. It's all encompassing. It does both.
That's interesting. Okay. And my other point of view was that these doctors knew, most of them knew that their patients were becoming addicted, and they continued to give them the opiates. And I have been a chronic pain sufferer all my life. Thankfully, I've not taken any illegal or legal prescription drugs for my chronic lifetime pain from various reasons. But I have noticed that Aspirus and Marshfield Clinic, supposedly they have pain clinics, but I think they need to be expanded and have a lot of other types of treatments for pain, because there are many more. In fact, I had a pain treatment.
Donna, if you could keep it germane to what we're, because this
Okay.
is about the settlement, not about.
So
if
I think
if I
funds could
Supervisor
go.
Krause, if I could.
This would be like a community and a government negotiation, because we're talking about private or nonprofit entities too, combining with government. And I think that the medical system is really what deals with these people, and they should be expanded, and they should be helping these people that have opiate addictions. Thank you.
Just to bring everybody onto the same page with what we are discussing today, the recommendation was that first item under the high category, which is conduct a gap analysis assessment of continuum of care for treatment and recovery in Marathon County. So that's a recommendation from CJCC. In our discussion at Health and Human Services, the majority of the committee sounded like they were on board with that option, but we were asked to have this joint meeting today to discuss it. So we are discussing if that item should be brought forward to the county board, or if this group has a suggestion for something else to be brought forward to county board. The list is in the packet. Go ahead, Supervisor Krause.
Yes, in regards to my previous comment, I thought we were able to comment on the various kinds of strategies. So that was the strategy that I mentioned that wasn't in there, and it should be. Thank you.
Anything further, I guess, from public safety? Do we have anyone from public safety who would like to make a comment or suggestion? Go ahead, Supervisor Marsh.
So the gap analysis, if you could refresh my memory about who exactly would be doing that, how much does it cost?
So I will turn that over to Administrator Leonard because that would be considered a implementation.
Sure. So I can tell you what our thought process would be we would put out a request for proposals to seek proposers who were willing to undertake that work. And we did a little bit of, investigation to get to the second part of your question, which is how much. And Laura from the Health Department and her team reached out to SAMHSA, the Substance Abuse Mental Health Service Administration. That was early in the week. And I mean, the estimate that we came up with for that was $50,000. I can give you, again, and I did this at the last meeting. This is my perspective on kind of the consensus of the group when we ranked these things, and I talked through how that worked. But my perspective on that gap analysis is that a lot of things have changed since the last time we've done one of those. Kind of building on some of the comments made at in the last meeting, it's really important to understand what exists, not only in terms of what programs does Marathon County government offer, but what other programs and services exist within the community and how do people access those to try to know where to deploy additional resources. And there was a comment made before about sober housing. Certainly that too was on the list. It was in that medium category of kind of expanding the access to that, but understanding what resources exist in the community on all of these different potential strategies that are permitted under the settlement. The idea was that hopefully a properly conducted gap analysis would help us understand that. I don't know if that answers your question, Supervisor.
So then the 50,000 would come out of the settlement money?
That was the recommendation from the Criminal Justice Coordinating Council.
Supervisor Krause?
I had noticed in the WCA magazine that Rockland County was doing this already 2 years ago, and I was wondering why is this coming up now instead of last year or 2 years ago?
Administrator Leonard, do you have a comment?
I don't know that my answer is going to be all that illuminative. The county board is in charge of when funds are allocated. The process that was used here was to get a recommendation from the Criminal Justice Coordinating Council. So that group met, as I explained in my the last presentation to each of the committees over the last several months. Judge O'Neill was here, I believe, for both committee presentations as well to talk through that process. There is no time limit on when you need to start. As far as I understand it, I'm sure there's some time during which the funds must be expended, but as is in the packet, you'll see that to this point, you've received several $100,000 of the initial settlement, which with an additional projected more than $2.15 million to come over the next 15 years. So you have, again, the choice for the county board is one really of resource allocation. And you can do that a number of ways. I know one of my colleagues, because I did interface with a number of my colleagues, one county created a public health nurse or a public health educator, position. Essentially, the dollars that they're bringing in each year will pay for the position for the foreseeable future, and that was their approach. Other counties have, I'm sure, taken on different strategies of how to expend those dollars. There are quicker ways to spend money, and then there are ways that are perhaps more deliberate or simply put slower.
Go ahead, Supervisor Krause.
Some of the monies have already been spent for various programs, And one of them is providing medication or methadone, whatever, in the jail to people who are going through withdrawal. I was wondering when that program started. The reason I question that is because someone had come up to me and told me how an addicted woman had actually been isolated and died because she was not getting the care for her addiction in the jail. And I know that was probably an illegal type of thing to provide her with heroin or whatever. But I was wondering when that has occurred, that the money is there now to give people who are addicted in the jail, to give them assistance.
Are you referring to in Rock County or in Marathon
No,
County?
in Marathon.
Okay, so none of the opioid settlement funds in Marathon County have been spent. This is what we're deciding right now to do
I
with
had
it.
read that some of the programs have already started and have been in progress.
I would concur with
The one in the jail.
Chair Van Cray that none of the opioid settlement dollars that we're talking about, that you are talking about here today, have been expended. That is really the policy question ultimately that the board will have to answer. Whether or not certain programs exist within the Marathon County Jail that are funded through other means, certainly there are a wide variety of programs that are funded. Quite honestly, everything else we do is funded with funds other than this. What those specific funds are is a different question.
I think maybe what Supervisor Krause's, correct me if I'm wrong, Supervisor Krause, but you were looking at the asterisks where we have additional funding in 2 and 3. It hasn't been implemented. We just have additional funding that would be added to the funding we're getting from the opioid settlement.
Okay, thank you.
It's my belief that the CJCC spent considerable time coming up with this plan, and personally, I trust their recommendations, so I'd like to make a motion to approve this opioid settlement fund deployment recommendation and move it towards the full board.
I'll second that. This is Mask.
Motion made in second, and this is just for public safety, then we'll go. All in favor, signify by saying aye. Aye. Any opposed? Public safety? All right, thank you.
Can I ask a question of clarification? Sorry, I should have done that before everyone voted. But is your motion relative to the funding of the gap analysis as the first step?
Well, the way it's laid out here with the first step, the high, medium, low, everything in here. Did you need something specific for gap analysis?
Am I correct in saying this, Administrator Leonard? I see what she's saying, or what you're saying and what she's saying, but the gap analysis number 1, then we'd use that money, then it would go to number 2, then it would go to number 3 is the way I'm envisioning this, unless I'm wrong. Correct?
That's how I see it.
Okay.
So if
My only question for clarification is I have some idea in my head based on our initial investigation about how much money the gap analysis would be. We don't have formal proposals to accomplish the next items down the list. Just for example, providing, expanding stable and sober housing. We don't really have any idea in a concrete sense in my mind. I'm not confident saying you need to allocate $75,000 annually to do that. I'm fairly confident that the $50,000 is sufficient to move forward with number 1.
Okay,
that was-
then
that-
I would like to revise my motion to move to the full board to conduct a gap analysis assessment of the continuum of care for treatment and recovery in Marathon County, the first strategy as high, not
Second,
to exceed $50,000.
agree.
Motion made. Supervisor Mask, are you okay with that?
Yes, yes.
All right, well, all approved?
Aye.
Any nays? All right. Thank you. Supervisor Gibbs, Chairman Gibbs. Whoa, way off.
Wow. Thank you, Mr. Chairman. I think one of the things that the gap analysis will determine is exactly that. Where are our shortfalls? Once we receive that analysis, then we can look at where's the next steps. What are we've identified, the CJCC has looked at it, but they haven't determined if there's some gaps in where funding could be utilized to fill those gaps. So I think that's what the gap analysis will determine, and a review of the gap analysis study will give us the direction of the future direction of the use of those funds.
All right, so then for Health and Human Services, do we have a motion?
I will duplicate Stacy Marash's motion for Health and Human Services.
Thank you, Supervisor Arstead. Is there a second? A second by Supervisor Krause. Is there any further discussion? Okay, all those in favor say aye. Aye.
Aye.
Any opposed? All right, none opposed. Motion carries. Thank you.
One clarification I'd like, I guess, is 129,000 was the July 2024. We're getting the 129,000. So let's say ballpark, it's the 50,000. So that extra money, if we get the gap, are we going to bring it back to the committee saying, we did the gap analysis, here's the money, we'd like to do it to 2 and 3, or are we just going to move forward with those, is my question, I guess.
I think that's a perfect point of, discussion from this group. And I don't know if you need the information from the gap analysis to kind of take that next step, but I think to your point, Chair Boots, that is the next question is, okay, you have, and it is a significant amount of money that you're going to receive from this one settlement, and presumably there will be more. But how do you want to deploy those funds? In the CJCC discussions, I think everyone kind of at some point echoed the similar sentiment that this is a significant amount of money, but it's not enough to solve all of the problems and do all of the things that are permitted under the settlement. So the county board is going to have some tough choices about how to deploy those funds. So thinking about what information you're going to need to help you make that decision, I think is always a good thing to have in the back of your head, or perhaps it's in the front, to then ask staff, hey, go get this information. This will be helpful for us. We thought the gap analysis would be really that primary source of information as you then have to parse through all the other choices that are available under the settlement, and of course some of the things that that council prioritized. But if there's other information once you receive that gap analysis, or even in the interim, that hey, we think this would be helpful, please feel free to discuss it now or reach out to me. I can see if we can start pulling that stuff together. I think building on the last presentation, one of my goals to bring to the county board is that idea that we have data to show you, kind of like Teresa said, I feel like a broken record when I say, like, how much have we done? How well have we done it? Is anyone better off? Because otherwise we do rely upon, significantly rely upon anecdotes and personal stories, which are important, but they're not necessarily always the best source of information. So if there's other pieces of information that the committees think would be helpful for them or the full board, please let me know.
So I guess what I'm hearing is we're going to do the gap analysis, we're going to bring it back to these boards, and then we're going to talk about it some more. That'd be the way I envision it, unless
Certainly that's my intent as staff, is once we get the information, we'll bring it back. I want to be very clear. There's nothing stopping you from making a recommendation to allocate, pick a number for any other purpose that was identified by the CJCC, or a purpose that wasn't prioritized by the CJCC but is nevertheless permitted under the settlement. You could do that at any time. There's nothing stopping anyone from the board to say, hey, we're going to allocate, like St. Croix County did, we're going to allocate $100,000 annually for the purposes of funding a position within the health department for a public health educator to address opioid misuse. That is permitted under the settlement. It's you don't need the gap analysis perhaps to do that. You don't need the gap analysis truly to do anything that you choose to do. You can allocate money however you see fit.
Supervisor Arstead.
So the CJCC recommended these high, 1, 2, medium, 3, 4, 5. When you look at 2 and 3, it says additional funding already secured. Does that mean that that's already in process, or are we waiting for the gap analysis to come out?
So it means that the funding has already been secured. So Teresa talked about, and Ruth can add, the Sheriff's Office deflection program that has, it's a partnership now between the Sheriff's Office and the District Attorney's Office, a contract position, essentially, LTE position within the DA's office to do that deflection work that Teresa referenced in the public safety meeting. I'm not overly familiar with the Wausau Police Department funding stream for the PARI program, but each of them, I would say, are similar in that they are targeting those low-level offenders to treatment. And Ruth, if you have anything to add, please just grab a mic.
I just want to clarify how this document is written out. Is that okay? Just for some clarification so people can understand. So on the pages that you're on right now with the high, medium, low, those are ranked where we found priority based on different types of analysis. But then if you keep going in the document, it has each strategy listed out that is in the high, medium, and low categories and where we are with that strategy. So some of the strategies we have not done anything on. Some we found it as a priority from the CJCC, but we're already working on. So the deflection one and the MAT one, we found during this process we already had funding for those. So that's why it has the asterisk next to it, because we already have those programs started, they are newly implemented, and they're funded through other sources. So if you wanted to look further into where each different one in the high, medium, and low categories are, the strategies are what tell you where the current status is and a little more information on each one.
Thank you, Ruth. Very good clarification.
Supervisor Crowley.
Yes, that answered my question. Yes, those programs are already being funded.
But understand that we could fund them through this monies. That's what we're trying to get at. Is the A-Strikes is, yes, it is already in our budgeting process. We are going to be utilizing money, but we could take money from this other money and put it there. That's what they're trying to get at. It's already allocated, but we could use these funds.
If I, just to build on that idea, I think, again, it's helpful to, as Teresa referenced in the last presentation, kind of see what for lack of a better term, the return on investment is for the strategy deployment. And again, my characterization of the discussion at the CJCC, consistent with what Ruth just alluded to, we're already started these things. Let's see how they kind of work as we get them ramped up. Do we need more resources? And this, again, would serve as that available strategy. But yeah, if you do have additional questions, please let us know. But thank you, Ruth, for the clarification with the document. Very helpful.
Go ahead.
Well, just a comment about CART. We had a discussion about a year ago with the Wausau Police Department and Health and Human Services about what a great program that is and what a difference it's making in the community. So it would be great if we could use some of this money for that. However, what we always hear is we have a hard time finding people to take those positions. So are we still in that situation now where we're not able to find more people to work in a counselor type realm?
I don't know that I have very definitive information for you. My understanding from recent conversations is that staffing within the crisis services area at North Central is better, but I can reach out and see. I think I'll have to look at the settlement documents if there is a question about CART, again, based on how CART in its current formation really responds to a wide variety of calls, mental health-based calls. So the question, again, based on the settlement is always, is the desired expenditure of funds within those listed as permissible under the settlement, but I can certainly look at that. We did talk about a similar model, the co-responder model, similar to CART, and that is within the document as well. I don't know, Ruth, Laura, if you guys had anything else you wanted to add.
In the opioid substance use world, a lot of that is overdose response, which we started as part of the deflection grant, is doing overdose response, where we can have law enforcement officers go with somebody, which was Dana that was here, into the community after someone overdoses the next day to make sure that they get into treatment. So that is kind of where we're at, and I think that's what Administrator Leonard was getting at too, is there's kind of a different kind of substance use model than CART is exactly it.
I was able to find it. It's strategy number 6.
Yeah.
That talks about that co-responder model.
Which
Supervisor
then
Marshall.
brings me, to strategy number 7, working with the at-risk students in the Marathon County School Districts, which goes hand in hand with the presentation we had in December about our truancy court. And we learned then that the mirror image program would really be beneficial to be expanded. And I realize it's just, the point being, that's something else we need, but we can't find people to do that job, and it doesn't really matter how much money you throw at it, because if you can't find the people to do it, it doesn't really matter. So I guess that's why I'm asking if it's any better with finding these people to take these positions. So thank you. And thank you for your clarification.
So then maybe that's a topic for Triple ED about the economic development of the county.
Well, there was a strategy that was discussed about, finding ways to expand substance use counselor capacity within the county. So certainly if there's interest in making sure that our gap analysis addresses that in some specific way, please provide that. But we'll certainly, in our request for proposals, ask for insight on that. I don't think we're unique in that there's just not enough, to your point, there's not enough people, particularly counselors, to get people in, but certainly it's a permissible strategy under the settlement to do some work in that area. I don't know if Ruth or Laura, or I see Krista's in the back. Krista, if at any point you want to add anything too, just grab a mic.
The one thing I would like to say is I think we should at least, I would say for public safety and health and human services, I would maybe agree that I would say we would do a presentation in April, because we have a new board coming up, and I think we need to get them on board and up to speed as fast as possible. So I believe that we should have some sort of presentation on this exactly right here to the new members of those boards, because I can tell you that we've all been first-year members. It's a lot to get up to speed fast, and this is something that's a lot of money we're talking about. So I would just request that we do that, I guess, for public safety, and I'm sure, Laura, I'll leave, or you know what I mean? I don't know, thoughts?
Well, I won't be here, so.
I agree.
Well, you can make a recommendation, though. I mean,
I agree with you, Chairman Boots.
Michelle,
I do too.
Michelle, do you think that's something that?
Yeah, I think it would be helpful for new members.
My sense is I think we can do that. I made a note when we talk about, one of the things we did in the onboarding last year was talk about funding streams for county government. To your point, this is a significant amount of money. I'll make a note to include that in that funding stream slide. If I forget, please don't hesitate to just poke me and tell me that, but I will, I think that's certainly something we can do.
But we're still going to move ahead with the, moving to the board with the gap analysis. Okay, thank you.
Go ahead, Supervisor Krause.
I like strategy 9. Several years ago, 3-4 years ago, I forget what kind of meeting I was in, but they were distributing this Narcan nasal spray So somebody who has an overdose and is not responding, you can spray that. People can have this in their homes and get this so that somebody doesn't die on their watch. Just thought I'd mention it. That's strategy 9.
I guess at this point, then anything further from public safety on our end? All right, with that, I would accept the motion for adjournment. We have a motion by Supervisor Marash, second by Supervisor Opal. All in favor? Aye. Any
Aye.
opposed? Motion carried.
All right, and Health and Human Services, do I have a motion to adjourn? Motion to adjourn by Arstead, second by Krause. All those in favor, aye? Aye.
Aye.
Opposed? All right, none opposed. We are adjourned.